Yeah.
Hello, it's a great privilege as a patient care representative to introduce the Bedfordshire team, whose work has been obviously explicitly patient orientated in improving the patient experience. So mindful of time, sorry we've drawn the short straw really, but could you address the same questions about why you chose this and whether you came across any challenges and how you overcome them and what next?
Okay, so initially when we started the programme, we came together as a team and identified the issues we wanted to tackle. So the first one really was delays in TTOs, meaning patients were often discharged later on in the day, and we had quite a fair few failed discharges as we weren't meeting the cut-off times for care. We also, our MDT meeting was very lengthy, constantly interrupted and not very well attended, and our ward rounds were also taking a long time, which we felt impacted on our doctors' ability to get TTOs and tasks completed, and they often overlapped our protected meal times, so it impacted patients' nutrition. So our aims for this project was to reduce the length of time of our MDT and ensure attendance of key staff, reduce the length of time on our ward round so it didn't impact meal times, and gave the team more time to complete TTOs. We also wanted to reduce complaints regarding miscommunication around discharges, as we'd had a fair few of those. And then we wanted to improve our length of stay and increase the number of discharges before midday. So, and again, we also wanted to ensure our TTOs were written in advance. We did a simple patient and staff satisfaction questionnaires, and these were to help hopefully improve staff engagement on our improvements journey. So we designed a simple MDT board, and this is updated every morning. And it's a guide for members of the MDT to keep focused on the tasks that are required that particular shift. We identify sick patients to prioritise first, and then new admissions, and then those that are medically fit for discharge. We also, in that meeting, we determine an EDD, and this is written on the board so our ward clerk can update our extramed system. Tasks are allocated during this meeting, and the next of the nurse in charge follows up these tasks to ensure they're done in a timely manner. There was a number of measures we established, and we collected data on the number of discharges morning and afternoon. We compared numbers of concerns and complaints over the last 6 months, and we collected length of stay data. We timed the board round and the ward round, and obviously we had the questionnaires measuring patient and relatives and staff satisfaction.
When we asked the staff about TTO timings, ward round action and task allocation board, they still felt there was some improvement. However, progress is being made in the right direction, and all the staff felt respected and listened to by their colleagues and peers. With our patients, the first survey that went out, there was a little bit of improvement. So when the second one went out, we were happy to know that our patients were feeling respected. They knew the day of discharge if everything in their recovery went to plan. And when speaking to families, they felt more involved than before when we started this project. This has led to less complaints and overall better satisfaction and well-being of our patients.
So our results, I think it's whereabouts is it on there? Oh yeah, so reducing concerns, as you can see on there, since June when we started the programme, we've steadily reduced the number of concerns over the months to 0 in August and again last month. The main themes of concerns over the last 6 months, 4 were around miscommunication. Obviously we've got down to 0 in November. Also reducing our length of stay, which is down at the bottom. Since August, we've steadily reduced our length of stay, and last month we were at our lowest with just over 7 days as our average length of stay. We're also measuring discharges early in the day, That graph is a bit difficult to read really, but we've still got quite a bit of work to do on this. We've met a few barriers with this, particularly as a majority of our patients are reliant on complex packages of care, so we're dependent on what time of day they can start their first care call, but we're working on that. But on the top right hand corner you can see our average board round and ward round times. Initially our board round was taken up to 45 minutes, and now with our MDT board and more focus on what's important to discuss, we've reduced the time to consistently below 30 minutes, and that's with full representation of all MDT members. And we've also, as you can see, reduced the time of our ward round as well. Patient satisfaction, the first graph shows the results of our initial survey, and the second are the results following the most recent surveys. And as you can see, there's an improvement on how much information is given to the patients that completed the survey. They felt actively involved, as Clara said. They felt involved in decisions about their care, treatment and discharge plans, and all patients knew their EDD and discharge plan. So we have met a few challenges along the way. We've had a high number of staff turnover since we started the programme. All our junior doctors and our registrar changed. All our therapists rotated. We had a new discharge planner. We lost a number of nurses as well, although we gained new ones, thank goodness. We no longer have a ward-based pharmacist either due to funding. So this is, as I say, is all added to our challenges. But on a positive note, the new MDT board and task allocation boards has enabled the new team to remain focused on what needs to be done. And it's certainly helped keep a smooth transition on the ward. And down at the bottom left-hand corner is just a few pictures of our achievements since starting the programme. And we feel this is really down to the ward round collaborative, because it's improved staff engagement throughout the whole process. It's certainly boosted morale on the ward as well. We have a notice board that highlights our achievements to date and keeps everyone updated on how the programme is going. And it's really enabled people, encouraged them to give feedback and make suggestions for further improvements. Elizabeth Ward has just won the Trust Team of the Month, and we've also been awarded silver in our last ward accreditation. They've also just been they've just given us an award this month from our TVN service for the highest number of days without a hospital acquired pressure ulcer. So I think it's up to 198 days now. So we just want to take this opportunity to thank you all for your support and guidance. This programme has really given us the opportunity to try out new ideas, although small, but they've had a big impact on our ward, and they've built confidence in our team to make improvements. So thank you.
Yeah, other thing, we will introduce this program, that means questionnaire and action boards to other wards as well, and we will continue to do things that are working and evaluate and improve wherever necessary. Thank you very much.